Good afternoon. I'm Ruth Crowder, the Chief Allied Health Professions Advisor for Welsh Government, and I'm here to introduce the shortlisted projects for the Welsh Government's Award for Value-Based Care, making best resources to maximise outcomes. Value-based healthcare is the equitable, sustainable and transparent use of available resources to achieve better outcomes and experiences for every person. This award category seeks to recognise the achievements of healthcare scientists and allied health professionals in delivering services that deliver high value when using public resources and deliver the best possible outcomes. The shortlisted projects are design and implementation of an adaptive pooling workflow for SARS-CoV-2 testing in an NHS diagnostic laboratory, Imperial College Healthcare in collaboration with NHSEI. Who said it was virtually impossible? South Eastern Health and Social Care Trust. Triage with Telly, TUT, Early Brief Intervention for Children's Physiotherapy, Anira and Bevan University Health Board. So let's hear more about them.
We're delighted to have been shortlisted for this award, and we wanted to share a little bit with you around what the pooling process has been and the learning that we've had doing this project. It's been a very exciting collaboration, and I'd like to hand over to Panos so he can share some of the learning and some of the outcomes with you. Panos, over to you.
Thank you very much, Ruth. Pooling was a very exciting project within London, where the ask behind it was to create a much greater capacity within the existing instruments and reagents available within the sector. And it was exciting because it was one of those projects where the outcome very much fell in place with a detailed plan behind it and delivered in many levels excellent scientific output, a very great collaboration between the university and commercial sector and the NHS, and created an operational plan that can be applicable to any laboratory within the sector. I'm very proud to be part of this process, and I am delighted to have met all those individuals in the area that we've looked at, and I'm looking forward to repeat the process over and over again with other challenges in the future.
Yeah, thank you, Panos. And if anyone wants more information on pooling, the whole point is that we're able to share, spread and enable adoption for this. So please do get in touch. Many thanks.
Who said it was virtually impossible? March 2020 saw the acceleration of our digital journey due to the unprecedented challenges of COVID. In the midst of these challenges, our team recognised opportunities which would have been previously unthinkable. Our digital journey moved in two directions: virtual training and virtual consultations. The menu of virtual training offered continues to grow and develop with ongoing investment in digital resources. The delivery of high-quality, safe and effective virtual consultations has ensured that our children and families have continued to access timely support throughout the pandemic, with the focus remaining firmly on the needs of the child. Staff identified challenges relating to service delivery, ICT issues and staff well-being, and we found solutions to support and connect the team, including lunch and learn sessions, how-to guides and flexible working arrangements. There were three significant outcomes: reduced waiting times, increased attendance, and improved access with benefits for staff and service users in terms of time, travel, shielding, work-life balance and homeschooling. We will continue to offer a blended approach with both face-to-face and virtual consultations as appropriate. We have developed a range of social media platforms, and we will continue to expand our virtual training to use quality improvement science alongside outcomes-based accountability framework, and we will share our learning. Thank you.
Hi, my name is Sarah Roberts and I'm a team lead children's physiotherapist working within Aneurin and Bevan University Health Board. The TUT or Triage with Telly project was developed to enable early visual contact via video with a child and their family who are referred for physiotherapy assessment due to concerns over walking pattern, foot position or mild gross motor delay. Many of these referrals will be for normal variations, but understandably parents will have concerns if their child is walking or developing in a way that they feel isn't quite right. This visual contact allows us to have an early exchange of information where we can give guidance and advice, which helps us to relieve parental anxiety, as well as reducing the need for children and parents to travel for a face-to-face appointment that may not be necessary, so saving both travel costs and travel time. This early contact has also empowered self-management, as well as releasing physiotherapy capacity to see children with the greatest need. Many parents commented that this service put their minds at ease and gave reassurance, and all felt that being seen quickly was hugely beneficial. We would like to develop and expand this service for other cohorts of referral and develop an advice line or drop-in clinic for parents and health professionals so we can make contact with families even earlier and in doing so improve the outcomes for our patients. Thank you.
Before I announce the winner, I would like to make reference to all the excellent projects that were shortlisted, because there really was yet again a very high standard this year. So now to announce the winner of the Welsh Government's Award for Value-Based Healthcare. Their plan was hatched pre-pandemic and then implemented at speed. The judges were impressed by this realistic and blended approach that has freed up time, enabling further staff development and improved services. And the winner is... Who said it was virtually impossible? South Eastern Health and Social Care Trust. Congratulations.